I think in the first instance, in terms of coming to accepting that you've got any type of mental health problem, it can be very difficult, particularly because there's no blood test for it. So I know when I've had particularly bad spells of depression, I would find that you don't think you'll ever get better, and I think that is when the resistance to getting help can really come in, because you don't think that there is anything that can help you. So I would say that once you do get the diagnosis, really do try and work with the clinician that you're seeing to try and accept that this is most likely what you've had and we've got, and work in terms of working towards a treatment plan. It might be a combination of talking therapy and medication, and it's important to really stick to that, because for me, once I got to a stable level of medication, the medication that I'm on is working. I mean, it will always need to be tweaked every now and again, but you get to the point where you think, okay, this is why I'm on this medication. And it can also be quite difficult when you are at that stable state to think, oh, I'm not actually ill after all. And that's when I think sometimes you might think, oh, I'll come off medication because I don't need to be on it anymore. But it's important to recognise that you are ill and it is a condition, just like you might have a diagnosis of diabetes or a long-term heart condition. There's lots of other physical health illnesses that you'll have but be stable because you're on medication, and it's the same with any mental illness as well. So it is really important to make that first step if you do think that there's something wrong, to make sure you do go to doctors. And it is very difficult. It is something that is definitely stigmatised against, and self-stigma, I think, is actually the worst thing, when you think, if I go to my doctor, they'll laugh it off or they'll laugh at me. So I think one thing I will say is always write down how you feel. So make a list of symptoms that you've been having. Maybe go to the doctors with a loved one, friend or family who's seen you in the position that you've been in the past few weeks or the past few months, because they can give some perspective. And once you make that first step, it can be the hardest step, is actually just making that initial appointment with the GP. But it's also important to realise that every few patients a GP is going to see someone who's saying, I feel low, I feel this, that or the other, and it's linked to their mental health. So it's not going to be an unusual thing for them to see, and if it's one in 4 adults at any one time that has a mental health problem, they're going to be able to signpost you in the right direction. So that's my advice.